Palpation of the hand and wrist. The physician palpates the distal radius and ulna by their thumb on the dorsum of the wrist to check for any swelling, bugginess, or tenderness. The physician palpates the Lister's tubercle, which is a bony protuberance on the dorsal surface of the distal radius. The physician moves his thumb 1 centimeter distally and then medially to the middle of the wrist in order to palpate the scaphoid unit ligament. The physician palpates the styloid process of the radius and the ulnar one. The physician palpates the extensor carpi ulnaris tendon near the ulnar styloid process to check for tenderness and swelling, specifically in the case of rheumatoid arthritis. The physician palpates the pisiform on the ulnar side of the wrist. Distal to it, the physician can find the hook of hamate. The physician palpates the scaphoid bone on the palmar surface during lateral extension of the thumb. Then, the physician palpates the scaphoid tubercle on the palmar surface, which is more specific for scaphoid fracture. The physician palpates the snuff box during lateral extension of the thumb. The physician palpates the 8 carpal bones, metacarpal bones, and the proximal, middle, and distal phalanges. The physician palpates the ulnar side of the metacarpophalangeal joint of the thumb to check for any ulnar collateral ligament problem. In case of proximal interphalangeal effusion, the physician can also use a 4-finger technique. The physician applies firm pressure by his index and thumb on the palmar and dorsal aspect of joint respectively. The pressure should be enough to blanch the nail beds. In case of effusion, the liquid will move to the sides of the joints. After that, the physician should feel with his fingertips for any bulgy or spongy sensation. This sensation is indication of joint effusion. The same technique could be used for distal interphalangeal and first metacarpophalangeal joint. In case of swelling or inflammation, the physician palpates along the tendons inserting on the thumb and fingers. The physician palpates any area where she or he suspects abnormalities.